Hi, everybody. This is Rob Packard. Today's discussion is going to be about internal auditing, but we're going to focus more on larger companies. So instead of the company that only has 10 employees and only has ISO 1345 or the FDA QSR to audit, we're going to look at contract manufacturers that are larger companies in the medical device industry and what's different about their audit program management. And then corporations such as somebody like J&J or Abbott, how do those companies handle their internal audit programs and manage the audit program? If you looked at the last two live videos that we did, one of them talked about what is the most frequently missed clause in ISO 1345 when you conduct audits. And then last week's audit talked about how do you audit the internal audit process. So how do the auditors get audited? Because you need to make sure you audit that process as well. So if you're interested in either one of those videos, check out the live feed. We actually have a playlist that's just the live feeds. But if you liked the format of last week's and the week before, where I used the whiteboard and I wrote on that, I can do more of that. If you guys would like it, just put comments below and let me know, hey, more whiteboard, please. If you like this format, we'll do this format more. But it's all based on what you guys give me as feedback. So please put some comments in there. If anybody's interested, I can also do a video about Remarkable tablets and some of the other tools that we end up using for a lot of our remote audits, because we do a lot of remote auditing for clients. But today's live session is specifically about how you audit contract manufacturers that are a little larger and larger corporations. And there are some definite differences for those companies. So we're going to cover that. And we're also going to cover what's going to be covered next week at the end of the video. So if you want to know what to tune in for next week, I'm going on vacation tomorrow. Yeah. But if you were worried that I wasn't going to do a video next week, I'm definitely doing a video next week, and the following week I'll be back on Friday. That's my last day. Vacation, I think, is Thursday, so we should be back on that following Friday. So number one question, and these are all questions that were suggested from my team because we do a lot of auditing. And they were like, oh, you ought to cover this question. So the first question was, how do you make sure you covered all the applicable clauses that need to be covered? So how do you cover all those regulatory requirements, and how do you make sure that you did? And we actually touched on this 2 live sessions ago, where I talked about what are the most commonly missed clauses. And part of the root cause of that is that you don't have adequate management oversight. So you need some simple mechanism for tracking, did I cover all the regulatory requirements? And usually what I do is I focus on how do we make sure we covered all of 1345 2016. And for anybody that didn't know, it's now 2021. So it's ISO 1345 2021, and it's the European version that made it the 2021 version. So if you're interested, you can purchase that very inexpensively, at least the amendment for 2021 on evs.ee, and I'll put a link down below. I should have done that before when I was preparing this. But evs.ee is where you can get it. I bought a multi-user license, and I think it was like 20 euros. So that's a good deal. And I'll be doing a blog about that while I'm on vacation, because I like blogging. So if you want to know how to cover all those clauses, all the applicable regulatory clauses, look at that video. But I'll cover this briefly in the part that I didn't cover. We focused on, you have a checklist for all of 1345 to cover every sub clause. And you just list, here is the report it's covered in, and here is the page in the report where it's covered. And many of the clauses should get covered in multiple reports, such as document control and record control, if you're using the process approach. But there are also regulatory requirements. So how did you make sure you covered all the MDR requirements? How did you make sure you covered all the Canadian requirements if you have the MDSAP certification? How did you make sure you covered all the FDA regulations? Sometimes we even become aware of new requirements that we didn't know have always been there, but they're new to us. We weren't aware of them before. How do you make sure you cover all these things? And The knee-jerk reaction that everybody says is, oh, we'll create a checklist for that. Well, if you carry that to its ultimate conclusion, you will have the world's longest checklist and you will never finish. So it's okay to rotate some of these regulatory requirements, particularly the ones that don't change. So for instance, if you want to cover how do we do a recall in each country, you could cover them all together as a recall process, or you could alternate, like the requirement isn't going to change and we're probably not going to have any recalls. So there isn't going to be a lot for us to audit. So you can document in a report there were no changes to the audit procedure. There were no changes to the recall requirements in any of these 3 markets where we do business. And we haven't conducted any recalls, so there weren't any records to review. And that's it. That's all you need to write in that report. It shows that you didn't skip the area, but at the same time, there wasn't anything new for the auditor to look at. So the process is still effective because we're still not doing any recalls. And we didn't need to do any recalls. If you had a recall, that's different. Now you have some records to look at. If you added on a new market and updated your procedures, that would be something to look at. If some of the regulations changed, like a few years ago, the FDA changed who the recall coordinator is for each region. They changed their regional structure from being multiple regions to just 3. Well, those are the kinds of changes you want to be auditing, not we do an audit every year because that's the way we've always done it. That's a bad reason. Audit when there are changes, when there's something actually to look at. In the times when there aren't changes, make a note in your report why you didn't look at those areas, because there wasn't anything new to look at. So it shows you covered it, but there wasn't anything to audit. So that's number 1 on the list of questions that was recommended by our team, things to cover. The next item we're going to cover is, what do you do if you have multiple sites? So it's not that uncommon for larger companies, particularly somebody like, let's pick an example, Paragon. They have multiple facilities where they're going to do auditing. Or any major medical device company or contract manufacturer, they often have more than one location. It might be as simple as, here's our manufacturing location and our warehouse is over here across the way. And you have to go look at both sites. In your audit schedule, you need to account for, we're going to travel from one site to the other, and you need to make sure that occasionally on the schedule, the warehouse gets looked at. Does the warehouse need to get looked at every single year? Well, are there any changes? Is there anything that suggests the warehouse isn't being well controlled? Have we had any supplier issues? Have we had shipping companies coming in and not arriving on time, not having enough space to park? Are we having any of those kind of problems? Are we having any distribution issues? Are we limited in storage and we just don't have enough space there? Is there a reason to go look at that warehouse all the time? Because if there's nothing changed and it's a smooth running machine, maybe you back off on how much time you spend there and how often you go visit that warehouse. It doesn't mean that you don't look at it. It just means maybe you don't need to look at the warehouse every year. Or you may say, we're only going to look at the warehouse for a short period of time. We're going to spend a half hour over the warehouse and look at what's new. So that's an example of one way you might have multiple sites. But there are other examples out there where you would have multiple plants. You have a really big company, you might have multiple plants, and a notified body or certification body has to figure out which locations are covered under that certificate. If you are hiring a supplier that has multiple sites, you should define in your supplier quality agreement which sites are covered and only audit those sites if you're going to do a supplier audit. So that's something that you should be considering in your audit plan. Which sites are doing activities that are relevant to the purpose of this audit? If they're doing functions that we don't hire them for, then we don't need to look at that facility. If they're doing functions that we do hire them for, then we should go look at that facility. But how often we look at it is a risk-based approach and depends on if we're having any problems with those activities. So that can determine how much time you spend and who you send to those locations. let's say you have multiple sites, but they're in different locations. So, different states. So not just down the road, but now it's in a completely different state, maybe even in a completely different country. In those cases, you might want to hire somebody that's local. So there are qualified lead auditors all over the world that can look at 1345. Do they all have to be from your company? No. You can have the bulk of your team is your audit trained auditors, but for that audit that's in Australia that would require an 18-hour flight, maybe if all that is a distribution center and that's all you need to look at and it can be done in 2 hours, maybe you should hire a local resource that is fully qualified and maybe even works on the side for a notified body so they have those qualifications. Send them in to do that audit. So something to consider. Go do those audits with external resources. Hire a consultant to do those instead of going there yourself to save some travel. If you have to go to that facility for another reason anyway, maybe it makes sense to combine all the suppliers and all the sites that you might want to look at in Australia in one trip. And that's done a lot with China, where you have multiple component suppliers in China, and you'll visit all the component suppliers. I've known a lot of Medline suppliers where that's their job. They're like, okay, I'm doing a tour of China. I'm going to go look at this province, and I'm going to cover all the suppliers in that province over a 4-week period. And that makes a lot of sense from a travel standpoint. It saves you travel dollars. It's a little rough on the person that has to actually spend a month in China, but if they like that job, they signed up for that job. If you hated that, you shouldn't have signed up for it in the first place, because that's what the job is. It's going, traveling places and doing audits. Now, what do you do if that facility not only has multiple sites or multiple facilities that you have to look at, but what if you have multiple standards that you have to look at? So we normally think very tunnel vision. It's all about 1345 or it's all about 21 CFR 820. But there are other regulations and other quality standards that might be applicable for a contract manufacturer. A contract manufacturer might have an environmental certification, ISO 14001. That's example. It could be the general quality system standard, ISO 9001. It could be QS 9000. They could be an automotive supplier, or it could be AS 9100. They could be an aerospace supplier. And for a lot of implant manufacturers, I'll see, they're cutting titanium. Well, you can cut titanium for the aerospace, the automotive, or the medical device industry. Which is the most critical? They're all critical. Planes fall out of the sky, car crashes, implant gets infected, and the person dies. They're all pretty critical. So they might be a great supplier, might have 3 totally different quality system certificates. You're probably only going to audit them for the 1345 requirements and the FDA requirements, maybe the CE marking and Canadian requirements too. But most of what they're going to do is manufacturing for you, so the other country regulations don't really have a big impact, except maybe on something like record retention. However, they have to do an internal audit. So if you're a contract manufacturer and you have to supply multiple industries with components or finished goods, how do you do that? How do you audit to all these different standards? And first of all, you're going to have to train auditors to all those different standards. If you don't have the resources and time to train all the people to all those standards, you're going to have to bring in outside consultants that are trained on those standards to do that portion of the audit. They could be part of an audit team. You could say, I'm the team lead. I'm the audit program manager. I'm going to manage the audit team, and we're going to do a full quality system audit. But nobody on our team has expertise in QS 9000, so we need to bring in a consultant to participate in the team just for those aspects that are the automotive standard. So that's something to consider. But when you're creating that audit program, okay, where would that new standard have the biggest differences between what we see in medical device regulations versus what those require? And that might help you decide what areas do you really need this outside expert to look at. Yes, you could create a checklist, but I think you're going to find that There's a large number of things in the QS 9000 standard that are similar to 1345. It's more prescriptive than 1345 is, but it has a lot of the same elements. So you should take a look at that and figure out where can I audit both at the same time, and train your auditors on how to do an audit of both for those clauses. For the other areas where it's unique to aerospace or unique to automotive, you're going to need to train somebody just on that, or you're going to have to bring in an outside expert for that area. So it's not a simple, straightforward, just do this. It depends on what your company is doing, what parts of the clauses are applicable, and what kind of expertise you have. And you're going to have to think about it strategically and plan way ahead. How are you going to do this? And you might tweak the process from year to year and not always do it the same way. Different people getting a different look at the system might have different input. You also, if you are in the process of training some of your auditors on, let's say, an AS 9100 standard or QS 9000, you might consider asking those auditors to go do supplier audits, because your contract manufacturer has suppliers too. They have component suppliers. Send them to facilities that have nothing but that quality system in place for aerospace or automotive, and they can learn from doing the supplier audit how it's done in other companies. That's how a lot of certification body auditors learn so much and become such experts. They've gone to all these different facilities and seen how it's done at multiple places, not just one company. So it's the broader experience that really enables them to do such an exceptional job of auditing. When you only audit your own company over and over and over again, all you know is how we do it here, not how everybody does it. And when you see the broader context, you make better decisions and have better ideas. So that's something to think about. Send your auditors to a supplier that just does that kind of thing. I wanted to learn more about lean manufacturing. I'd already worked in an automotive company and a tier one supplier. I thought I knew a lot about it, but I said, it's been a little while. It's been a few years. Why don't I go to a supplier that is really good in this, and that's one of their core business? I did that, and I learned a ton. Some things had changed since the last time I had been trained on it. So I learned a lot in that process. So you might try that as well. Okay, the next one, in Sharon Moreau on our team, she has more experience than I do in running quality systems. And she had this suggestion. She was at a bigger company, DeRoyal, and they had corporate audits. They have corporate policies and procedures. They have plant level procedures, and they have department procedures. And so that makes it a little bit more complicated when you have corporate level things and you have plant level things, and then you have department level things. You have different levels of hierarchy in what the requirements are. So how do you audit that? Well, my number one thing that I want to impress upon people here first, this is going out to all the people that are managers of these quality systems or directors or VPs. When you have this responsibility, streamline your quality systems. You do not need corporate for everything, plant for everything, department for everything, and then individual work instructions. You don't need all those levels for every single thing. It doesn't add any value. So wherever you can, just have one level for that process, and that will make things a lot easier for people to learn and maintain. When you have 4 different levels of document control to consider, it becomes confusing, and it becomes very easy to have conflicting requirements in the different documents. It's hard to make your corporate policy procedure, your plant level procedure, your department level procedure, and your work instruction on document control all match all the time, particularly if you have multiple standards that are involved. So don't do that. For things where you have a corporate policy or procedure, if it's good enough for all the plants, then have everybody follow that. Don't bother coming up with plant level ones. If one of your plants needs to do it differently because they fall under different regulations that are more prescriptive, then say, the corporate policy applies to all these sites except for this one. And so you say it right in the scope of the corporate procedure. And then in the quality manual for that location, you say, we don't follow the corporate policy for this. Instead, we follow this plant procedure. So you have one or the other at that exception plant. You don't have both. Both just creates confusion. People don't know which one to follow. So make sure you make that detailed explanation in your quality manual. Another thing I see along the same lines in the quality manual is companies will put the requirements in the quality manual and then they'll put it in a procedure. So I'm going to read for you what I have done. And the quote that comes to mind here is, if I had more time, I would have written a shorter letter. It's a very famous quote. A lot of people have been attributed to that, but it's been around for hundreds of years, that statement. It takes more work to write less, to shrink it down to just the essence. So when people look at my quality manual, they see a really short quality manual and say, what did I pay for? You paid for me to edit 12 different times, trying to get you a very short, concise quality manual that has no fluff. So here's what's in the section for management review. And it probably looks nothing like yours, but this is what's in mine. And I read for you here. First of all, it's only 13 pages, the whole quality manual. But in section 5.6 for management review, it says the requirement for management review process is defined in the management review procedure, SYS 003. That's it. One sentence. That's all there is. Tells you where to go find it. And that makes a very efficient quality system. So if you have a corporate level procedure, tell people to go see that. Don't have both if you don't need to. If you have a department like QC testing for pharmaceuticals that has to do things a certain way to comply with the pharmaceutical regulations, and you don't do things the same way the other parts of the business do because you have those pharmaceutical regulations, then it makes sense for that lab to have a different policy than most of the other departments. But that doesn't mean every department needs its own procedure. If the corporate one or the plant one will do the job, don't come up with a new one just for the sake of coming up with a new one. Every single department does not need a procedure when the plant procedure would work just fine, or the corporate procedure would work just fine. Another thing you can do is color coding in the manual. Say, anything that is this color pertains to this standard. Anything that's this color pertains to this plant. So you can color code things. You can use different fonts. You can bold. You can underline. You can even use symbols. We have symbols all over our labeling. Is it prevented for you to come up from your own symbol to identify the different plants? No. Well, our Canadian plant, go figure, they have a Canadian maple leaf next to it throughout our quality manual. So wherever we're talking about the Canadian plant, you see the maple leaf there. Okay, I figured it out. I cracked the code. So try that out. Try using symbols. Try using color coding. Try using different fonts to help people navigate. Oh, I'm supposed to audit the Canadian requirements for the Canadian plant, so I'm going to go through our quality manual and see where all the Canadian requirements are. I wish I didn't have to read the whole manual. Oh, I just looked for the Canadian maple leaves. I'm good. And maybe if it's an IVD, you use a symbol for an IVD. There actually is a symbol in 15223, I believe, for IVDs. So there is a symbol out there for just about everything. You could create your own. You can have a little index at the end that explains the different symbols. And it would be great to train your auditors on those different symbols. So those are some suggestions of how you might handle different larger audit programs, contract manufacturers with multiple sites. A larger company would handle it. And, basically we have clients in two different categories. We have most of our clients are small startups that don't have a quality system. They're starting from scratch. But then we have a subset, a very small subset of our customer base that hires us for training. So the bigger companies invest in training because they have a lot of people to train and they want to have somebody that really is good on this topic. So we get bigger companies investing on lists. Please come in and do a mock FDA inspection. Please come in and do a training on CAPAs, root cause analysis, design controls, post-market surveillance. Rather than training everybody individually, they want to do a group training, and they might only pay a little bit more for training a larger group, but when you spread it out all over those people that you're training at one time, it's per person. It's actually fairly effective to fly somebody in and have them do training. And if they have multiple areas they can train in, you might be able to cover multiple topics. I've even seen companies where they'll rotate departments, like, okay, do a training on this new standard for this department, what matters for that department. And then we'll bring in a different department and you can give a slightly different training for what matters on that new regulation or new standard for the second department. So you might have, here's one for quality, here's one for regulatory, here's one for purchasing, here's one for management, here's one for the whole company. So the whole company's aware. Some of them are recorded, some of them aren't. Some of them have a lot of QA. Some of them have examples that we'll go through. So it depends on the department's needs. And so we might spend a whole day on risk management for a new standard, for like the 2019 standard or the 24971 guidance. Might spend a whole day on that, but every department gets a different training that's specialized for what that department needs. And you can do the same thing for your audit program. You can figure out, not everybody's doing the automotive requirement. Not everybody's doing the aerospace requirement. The ones that are, here's what they need to know. Here's what training we need to give them. Here's what different procedures they should have and how we should handle it in our quality manual. So I hope that was helpful. I really appreciate my team giving me some good questions to work with this week. It's always better to have questions from people to give you a live session on training rather than whatever comes up in Rob's head. So next week's training, I'm going to be on vacation next week, but next week's training, we're still going to do live. It just won't be from this room. For the training, we're going to talk about what you do at the end of the audit. So at the end of the audit, we have a closing meeting, but you have findings typically. How do you initiate the CAPAs? How do you initiate CAPAs from a 483 if an FDA inspector is doing it? How do you do it when a notified body is giving you some findings? How do you do it when it's internal? Should it be different from those three? So that's what we're going to cover next week. So please attend. It'll be the same time. It'll be still 12:30 Eastern time. I just won't be in that time zone. So wish me luck. Happy travels. And I hope to see you next Friday. If you like this video, don't forget to like it. And if you have any suggestions, please visit our suggestion box and put in an idea for a new topic. Thank you. See you next week. Bye-bye.